Okay, so this is shoulder flexion, and we're going to just look at how the scapula moves, and we're going to look at how the humerus moves as well. And I'll have some different angles for you to look at. But we're going to do shoulder flexion and then return from shoulder flexion or shoulder extension. So Sam, if you wouldn't mind just reaching up with your arm, leading with your thumb, I'm just going to get an idea for how he's moving, right? So I'm going to have him go up and down a couple times, and I want you to look at the scapula. And go ahead and do, are you okay? Mm-hmm. So go ahead and do that a couple times for me. And remember the scapula-humeral rhythm, go ahead and come back down. We want the scapula to upwardly rotate about 60 degrees, that's normal. We want the humerus to flex about 180 degrees, and I'll let you see that on a different angle. But let's spend some time here in the scapula. So when he comes up, you can see on both sides there's a pretty nice upward rotation. Go ahead. So you can see how it upwardly rotates. And then he does start to extend here. Not quite to 180. Go ahead and come back down. So I'll show you that angle here in a little bit. But the scapula, we want upward rotation. Okay? And we want about 60 degrees. And we want to look at, are they symmetrical? Right? So if he comes up, and one significantly upwardly rotates, and one doesn't upward rotate at all, it just stays kind of in a neutral or downward rotated position, we got to think of why that is. So go ahead and come back down. So overall, I mean, at the end you can see he kind of likes to adduct and kind of reposition. But overall, looks pretty good. Go ahead and come up one more time. Watch his scapula as he comes back down. Okay, as he comes back down, they're pretty, I would say they're pretty good. They're coming down smoothly. They're not just dropping fast. So what we want to look at is the inferior angle. If you come up against Sam, we want that inferior angle to get to the mid-axillary line. So now I'm going to just have you turn. There we go. Go ahead and come back down. And then as he raises up, he's going to raise up this inferior angle I'm going to follow. Go ahead. And they should be in this mid-axillary line right here. That's normal. We want that. That's good. And then back down. Okay, so that's the mid-axillary line. As he moves, we don't want to see a ton of anterior translation. So he might complain of pain as he raises up. So as he comes, he might say that he's getting some pain here. And all that's telling us is it might be anteriorly translating. Go ahead and come back down. The anterior translation can cause pinching and pain. Or it could be a superior translation, which could cause impingement, pinching or pain. If we have a superior impingement, we're thinking that the rotator cuff muscles aren't doing their job to depress the humerus. If we have an anterior displacement, we could be thinking anterior joint laxity. We could be thinking the subscapularis is long, right, which could allow that anterior translation. Or we could think of these posterior muscles, the posterior delt, the teres minor, infraspinatus could be stiff, which doesn't allow the humerus to glide posteriorly. So it's going to want to shift anteriorly. Okay, so let's have you face this way. Let's talk a little bit more about the scapula. We said that the upward rotation is normal. So if his scapula does not upwardly rotate as he elevates, which his does, I think his does pretty well, and then as he comes back down, we want that slow, controlled motion back down. If he can't upwardly rotate, we got to think a couple things. One, the downward rotators could be short or stiff. So like the rhomboids could be restricting them, the levator scapula could be restricting them. Okay? And the upper traps, for example, could be weak or long, not allowing it to upwardly rotate. Okay, the serratus anterior could be weak or long, not allowing it to upwardly rotate. Okay, again, if he's stuck kind of in that downward rotation, we're thinking the rhomboids are short or stiff, levator scapula short or stiff. One more time, let's have you face the whiteboard. If we have him flex up and he can't get to 180 degrees, you can see he gets some extension. We could say the lats aren't allowing him to flex fully. Okay, when he flexes, the scapula should depress a little bit at the end range. If it's not depressing, you can go back down. When we're at full flexion, if his scapula does not depress, the pec minor could be short or stiff, which causes a little bit of that anterior tilt. And it's not going to allow it to depress. It might be more in that anterior tilt position. Okay, so we can stop there.